Hello, I'm Professor Claire Rusbridge. I'm a veterinary neurologist. Welcome to my YouTube channel. Today we're going to talk about 5 things you should know when prescribing gabapentin. Gabapentin was originally developed as being similar to GABA, a neurotransmitter in the brain, and it was originally thought that it would have properties very similar to GABA, but actually it ended up being a lot more complex than that. And in veterinary medicine, it's mostly used for treating maladaptive and neuropathic pain. So what are the 5 most useful things to know about gabapentin? Well, the first is, how does it work? Gabapentin prevents the release of the excitatory neurotransmitter glutamate. Now, glutamate is found throughout the nervous system, but where it's pharmacologically useful is at the level of the spinal horn. And in particular, glutamate is the neurotransmitter of pain. Now, some of you may have seen this diagram before because I also used it in the video on the neurobiology of pain. But when a pain signal is received from the periphery, it travels up the C fibers or the alpha delta fibers, but in particular the C fibers release this glutamate and also another substance called substance P, or P standing for pain, and that binds to the AMPA receptor on the postsynaptic membrane, that is to say the neuronal cell in the superficial dorsal horn. Now, if enough of that glutamate binds, and also binds to a receptor called the NMDA receptor, then you get an action potential and eventually release of a magnesium block on the NMDA receptor. And what then occurs is that the membrane becomes much more sensitive and hyperexcitable, which means that only a little bit of a pain impulse is capable of generating an action potential, and we call that process wind up. Therefore, if you have a substance which will stop the release of glutamate by acting at this site, then it will stop that wind up and therefore reduce that central sensitization, which is involved in receiving pain impulses, but absolutely paramount in the development of neuropathic pain. Gabapentin also has a supraspinal, that's to say outside or above the level of the spinal cord site of action. It has an action at the level of a brainstem nucleus, which is called the locus ceruleus. It's sort of roughly in the center there. And what the locus ceruleus does is it activates descending noradrenaline control, and this is inhibitory to the dorsal horn. So as well as stopping the release of the excitatory neurotransmitter glutamate, it also enhances this noradrenaline descending control, and it does that by reducing the presynaptic GABA release and also induces glutamate release from the locus ceruleus astrocytes, the astrocytes being cells that help support the neurons in the nervous system. And it's thought that this might be the action, the site of action when gabapentin has its other effect, which is anxiolytic, that is to reduce anxiety. So what do we use gabapentin for? Well, by far the most common use is reducing neuropathic and in some cases post-operative pain in both dogs and cats. It's also used as a drug to reduce anxiety, especially in cats, and that's where it's most common, that you can give it prior to a veterinary visit to a cat and it reduces their anxiety. You can also do that in dogs, but it's more effective as an anti-anxiety drug for cats than it is in dogs. However, there have been some trials in dogs for its use in storm phobia, and it did have a positive effect. Originally, gabapentin was developed for epilepsy, but it really is not a particularly good anti-epilepsy drug. There's lots of other alternatives which are more effective, and most veterinary neurologists don't really use gabapentin for epilepsy. And I also want to put a little note here that I've seen an increasing amount of gabapentin prescription from general practitioners who cite the reason is because it's neuroprotective or because the animal is neurological, thinking it's some sort of general tonic against neurological conditions. It really is, there's no reason to prescribe it at all if the animal is not painful, if it's neurological because of another reason. And especially as the adverse effect of gabapentin is to cause ataxia, you will make that ataxia worse. So if you've identified spinal disease but you haven't identified pain, then please don't prescribe gabapentin. What is the dosage and the administration? This is the second thing that you should know. Well, the dose rate in the dog is between 10 and 20 milligrams per kilogram. However, there is that range really for two reasons. The first and most important is you should start low and titrate up. So you start at the lowest end of the dose range and gradually increase it. And the second reason why there's that range is that the tablet sizes, capsule sizes, mean that you're unlikely to be able to dose it precisely in many animals, so you need a little bit of a range. In the cat, we generally start at a lower dosage. We generally start at 5 milligrams per kilogram, and that is really because the cat is much more sensitive to the adverse effects of it. But for going to the vet, we dose it much higher. We can expect the cat to be very sedated then, and it's dosed at 20 milligrams per kilogram. It really should be given 3 times a day. It doesn't last for 12 hours, generally in the dog. In cats, we can start it on twice daily, and the peak plasma concentration is about 1 to 2 hours after you give it. So just sort of talking about that 3 times a day usage, although it is less convenient, if you are giving it twice daily, then there may be periods where the animal is not covered. So this graph is just to really illustrate. If we give it 3 times daily, say at 6 a.m., 2 p.m. and 10 p.m., then we get a peak. A couple of hours later it falls off, but it never goes down to absolute zero. And assuming that pain control is achieved at above this level, the animal will always have a reasonable amount of the drug in their system. If we compare that to giving it twice daily, then there were periods of several hours perhaps where there is not enough drug in the system and the animal may be painful. Now, of course, there will be lots of people listening to this who will say, oh, but I only give it twice daily in my dog and they're fine. Great. If it works for you, fantastic. It may be that your dog doesn't require that much, or perhaps it lasts longer in your dog, but that for the majority of dogs you really need to do 3 times daily. So the peak is 1 to 2 hours after giving the drug, and you need to consider the timing of your activities associated with that. Most people find it's very useful to give it first thing in the morning. Obviously the animal may be waking up, more painful, and you want to get them going, so it's given first thing. And then hitting the peak at about 1 to 2 hours. For some animals, they're going to be very sleepy or wobbly, and so that's not a good idea to plan your agility. However, for others, that's not an issue. They're not very sleepy or wobbly after they've got used to the drug, and it's actually better to enjoy their activity when they have the maximum analgesia. So for many owners, they will plan taking the dog for a walk whilst the drug is at their peak. And of course, for cats, we're giving a high dose. We're giving it 1 to 2 hours prior to the vet visit, so that when you get the cat into the consulting room, they have that maximum anti-anxiety effect. However, we will expect the cat to be sedated and wobbly, and the vet needs to take that account, especially if they're doing a neurological examination. There's no veterinary formulation. This has been given as an unlicensed extra label medication. What does that mean in practical terms? Well, a licensed medication means that it's gone through specific trials to determine safety, toxicity, pharmacokinetics, and efficacy. And so all of the information that we have about gabapentin's efficacy is based really on some very, very small studies. And there really haven't been great studies on its effect at neuropathic pain, despite the fact it's so widely used. However, there are good studies looking at the pharmacokinetics, so we do understand quite a lot about its timing of its action and how it's eliminated, etc. So these capsules are all for humans. These are the human capsules, and as a consequence, some people will have their prescriptions from a vet as a paper prescription that they take to a local pharmacy. In other instances, vets will buy these through their suppliers. But the smallest dose for a human is 100 milligram, which can be problematic in very small animals, so your toy breed dogs and your cats. And so you can get compounded, specially made tablets in 25 milligrams and 50 milligrams through specialist veterinary pharmacists. However, because of the process in making these do generally work out more expensive. You can also get a liquid gabapentin. However, you need to check and make sure that it's xylitol free. Of course, xylitol is very toxic to dogs. It causes profound hypoglycemia. And so we want a xylitol-free solution, but that liquid can be better for accurate dosing in cats. It can be given with or without food. Most people give it in the morning, perhaps with a small treat, and feed later, but you can give it with the breakfast if that's necessary. And sometimes giving it with a small treat is useful if the animal vomits. However, if you're giving antacids, don't give within 2 hours of the antacid, otherwise it will affect its absorption. And ideally, don't open the capsules. If you have to open the capsules and sprinkle them on the food, well, you'll get enough gabapentin in there, but it may change the absorption because these capsules are designed for releasing in the stomach and small intestine. But more importantly, it does have a bitter taste. So the third thing is, how is gabapentin metabolized, which means broken down and eliminated from the body? There's often a lot of misinformation about this on the social media sites, so I particularly wanted to deal with this aspect. And actually, gabapentin, it has very, very little metabolism in the body, very minimal liver metabolism. In fact, in humans and cats, it's supposed to not be liver metabolized. But in dogs, it does have a very small induction of liver enzymes, and so we think there is a proportion of it, up to about 40%, metabolized in the liver. But this does mean that this drug is suitable if there is a compromise of liver function. It's excreted by the kidney unchanged. So it's not metabolized by the kidney, it is excreted by the kidney. So it will not damage the kidney, but we do need to show caution if there is kidney disease, because if there is kidney disease, then the kidney will not eliminate it into the urine as quickly, and therefore we can get problems with accumulation of the drug. So getting basically the drug accumulating in your body system and have more adverse effects. And so if the animal has abnormal kidneys, if you do have to use it, if there really isn't a better choice, then what I advise is that you measure the serum concentration. You can do that through human labs. And what I would prefer is to measure the peak. So that's 1 to 2 hours after dosing. If you've just given the drug, then 2 hours after dosing. If the animal's been receiving it for some time, then 1 hour after dosing. And this should say the trough. I just realised this is a spelling mistake. And the trough, so when the drug is likely to be low, should we say about 8 hours after dosing. The therapeutic range has not been established in cats and dogs, so I use the human range as a guide. The fourth thing to know is, what are the adverse effects? Well, the dose-dependent adverse effects, which are basically pretty common but dependent on the dose, so likely to be seen at a high dose and less likely to be seen at a low dose, is sedation or drowsiness. So that may manifest as a reduction in activity. However, some painful animals actually have an increased activity because they were so uncomfortable before the gabapentin, they were less likely to exercise, and after prescription of gabapentin, they become much more likely to exercise. Where reduction in activity is really noticed is when it's used for painful conditions in cats, for example, neuropathic pain in cats or feline hyperaesthesia syndrome, or feline orofacial pain syndrome. You can get some mild ataxia. This usually improves after a couple of weeks. Again, it's most noticeable in cats, mainly because cats do a lot of activities such as high-level jumping and balancing skills that need a good fine motor control, that you really sort of notice them being slightly off when they're on gabapentin. It does increase your appetite, and if you're not careful, the animal will gain weight. They won't gain weight if you don't feed them extra, but because they have an increased appetite, they're much more likely to finish their ration or ask for more treats or scavenge. More unusual adverse effects, which can actually be quite rare. You can get an exacerbation or even a cause of myoclonus. That's a muscle jerking. That's a particular note if it's a Cavalier King Charles Spaniel, because they do get an age-associated myoclonus that's unrelated to having gabapentin, but if they are on gabapentin, that might make it worse. And it can also, at least in humans, make some seizure types, such as absence seizures, worse. It's not really something that we see very often in veterinary medicine. I think I can think of one case where an animal developed myoclonus after being prescribed gabapentin. So it's just something to be aware of. Very rarely you'll see gastrointestinal upset. That may help by having the tablet with the meal. Most of the time, this is a coincidence, and you find that if you try the tablet again, it's absolutely fine. But there will be occasional rare animals that can't tolerate having gabapentin because of vomiting and diarrhea. And a very rare side effect, which is actually only been reported in humans, but I'm putting it in here just in case, is that it has been associated very rarely with respiratory depression. And this is particularly so if you've already got depressed respiratory function. So this, where you might need to be aware of it, for example, is if the animal is on gabapentin already and then develops aspiration pneumonia. So, for example, the post-operative spinal patient on gabapentin that develops an aspiration pneumonia because they're brachycephalic, for example, because they're a French bulldog. So in that instance, I wouldn't continue to give the gabapentin, just in case. I would be giving other analgesics in that instance. How is it monitored? Well, you do need to have regular veterinary checkups. It doesn't have to be every month, but I like to see cases initially after a certain period of time to establish whether or not it's had an effect. So usually the first check will be after 4 weeks, and then after 3 months, then perhaps 6 months, and then yearly for animals that are on lifetime medication because of their painful conditions. For example, many dogs with Chiari malformation and syringomyelia will be on lifetime medication. You need to do a dosage adjustment based on their response and their tolerance, but you also need to think of that later. When a dog becomes older, I find that they're less tolerant to gabapentin and pregabalin, and so I may be looking at reducing the dose, but still having the same amount of analgesic. And I do an annual blood test looking at the hematology and the kidney and liver parameters. I very rarely ever see a problem, but if you don't monitor it, then you're not going to see that problem until it's too late. And finally, the last thing to know is that this is a controlled drug. It's a Schedule 3 Class C controlled drug, which means that in a veterinary practice it is stored in a locked cabinet that has to be compliant with certain regulations. It does mean that it's illegal to possess a gabapentin unless you have a prescription for that animal. And if a vet is providing a prescription as opposed to prescribing it from their practice, then there's many regulations on those prescriptions, but most importantly, relevantly for owners, is that you can only dispense it once. That means you can't write repeat prescriptions. So for some animals on, say, repeated thyroid medications, you can write one prescription and then put repeat 5 times so as to give the owner 6 months worth of drugs and to save them the inconvenience of having to get repeat prescriptions. But you can't do that with a Schedule 3 drug. The other important thing is that the signature has to be handwritten and dated, and you also need to make sure you have the vet's qualifications. And I know there are people who are not in the UK, but this is the UK regulations, your Royal College of Veterinary Surgeons number. We need to put the prescriber and the patient address in there. You need to have the total volume in words and figures. So that means that if I want to give 100 tablets of 100 milligrams, then I need to write that in numbers and in words. And I also need to do the same for the dose. So I would write for my 100 tablets of 100 milligrams that I want to give 100 milligram tablet 3 times daily. All of that has to be in words and figures as well. And I also need to write on this for animal treatment only, and I'm prescribing under Cascade, which is the authorization that I can use to prescribe gabapentin, because other drugs against other painkillers have been ineffective. You should use licensed medication first in Britain. So those are the 5 things that you need to know. Upcoming, we're going to have 5 things that you need to know about prescribing pregabalin in dogs and cats. You can see that pregabalin has a chemical structure a little bit similar to gabapentin, and it is included under the gabapentinoids. So we talked about 5 things you should know about prescribing gabapentin. How does it work? How to administer it? How does the body get rid of it? What are the adverse effects? And that it's a controlled drug, at least in the UK. On the next video, we're going to talk about pregabalin. It's very closely related to gabapentin. You can see the molecular structure here. Has a very similar oxygen and nitrogen groups. This is gabapentin here. And until then, bye-bye.